Hi, I'm Nancy O'Neill. What does aging gracefully mean to you? Well, it means something different to everyone. No matter what age you may be, Aging Gracefully on Suncoast FYI offers advice that could help you live a healthier life. Each week we hear from a variety of specialists on a wide range of subjects. So please join us for Aging Gracefully on Suncoast FYI. Joining me now is one of Sarasota's top cosmetic surgeons, Dr. Sessa. Over the next several weeks, he will share his insight and expertise on a number of treatments that are available through Sarasota Surgical Arts. Today's topic will be on the benefits of facial rejuvenation. Good morning. Thank you for being with us.
Thanks for having me.
Now, I know that all of our viewers want to jump right into what we're going to talk about today, okay, facial rejuvenation, but could you tell us a little bit about yourself and how you came to be in Sarasota?
Sure. So, I'm an Italian-American who grew up in New York, after graduating high school, I just kept moving further and further away from New York. Eventually, I made it down to Louisiana, where I went to medical school, as well as did my surgical residency. Then I went on and did a fellowship out in Utah and just in cosmetic surgery. And while I was at LSU in New Orleans, I met my now wife, and we now have 3 young children. I have 3 small sons. And we moved to Sarasota about 10 years ago. And that's when I started my practice. It's a solo practice. And really the way it happened is after September 11th, my family just decided that they did not want anything to do with New York anymore, so they moved to Florida. And I was away in school and residency and so on and so forth, and I decided that this was as good a place as any to raise a family.
To raise children, absolutely.
So we moved here, and we've been very happy here since.
Great. Well, we're happy to have you here.
Thanks.
Now, let's start. When should somebody consider getting a facelift? I know that's a very personal question. And what do you say to your clients that come in?
So, you know, that's a very personal question, just as you put it. So really, I never mention to people during my consultations, I'll never sit down and say, this is what you need. This is what I suggest for you. It's always, let's look in the mirror together and you tell me what it is that bothers you. So
I like that.
It's something that what bothers you may not bother me, and what bothers me may not bother you.
Yeah.
So I've learned a long time ago not to say what I'm bothered by. So if you look in the mirror, let's say you're 45 years old. I'm 45 years old. Let's say look in the mirror and you're 45 years old and you notice that you have a little bit of creasing or maybe some heaviness in your jowls, or maybe you're starting to get some looseness in your neck. So that may be time to maybe start thinking about doing something.
Okay, but
maybe not a full facelift,
right?
Right?
Maybe not a full facelift.
So, right. So, you know, when you talk about facial cosmetic surgery, it's all about how much something bothers you.
Right.
If it bothers you enough to correct it surgically, then you're ready to have a facial procedure done.
Okay.
I just want to just expand on that slightly, in that facelifts aren't one size fits all, right? Think of facelifts as a continuum. So early on, you have a mini lift to fix maybe minor things, minor issues. Then you have more of like a modified facelift, which is a little bit more aggressive to fix maybe some things in your neck, maybe a little bit more loose skin. And then you have a facelift, which is what I consider facelift, neck lift combined. A lot of surgeons separate the two, where you do facelift and a neck lift. But when I call it a facelift, just for all intents and purposes, think about face and neck all together. Because as far as I'm concerned, it's all one structure.
Well, I would think so. I would think if you're going to get your face done, you can't have all the wrinkles on your neck. Now, can you give us an idea how much younger you're going to look after surgery? And again, it
Sure.
depends on how much surgery you have done.
Sure. So I've done surgery on women that say that they look 30 years younger. I've done surgery on women that say they look 10 years younger.
Right.
15 is probably about the average that you could expect. And it's not just the surgical procedure. It's, you know, a lot of women bring in pictures. This was me when I was, you know, 20 years ago. This
Right.
was me when I was 15 years ago. No one brings in a picture and says, this was me last year.
Right.
You know?
They have to be realistic, though,
Right.
with what their expectations
Right. Yeah.
are and what you can do. And when you do this surgery, how long do the results last? I mean,
Yeah.
if they're looking for 10 years or 15 years, how
Yeah.
long can they expect that to last them?
So everything that I do is permanent. So technically, when you hear the word permanent, you think of about 5 years.
Okay.
But with this type of surgery, think more along the lines of 10 to 12 to 15 years.
Okay.
Really depends on where you were when you started.
Okay.
So if you were early on in that continuum, expect 15 years of solid results.
All right.
Now, I'm not going to stop the wheels of aging,
Right.
right?
Can't do that.
But if you took a picture of yourself and cut yourself in half, and one had surgery and one didn't, and then moved 15 years down the road,
Right.
the one who had surgery is going to look significantly better
Better.
than the one who did not.
Okay.
So think of cosmetic surgery in that sense. And it's okay to think, well, hey, you know what, I got this done in 8 years, 10 years, 12 years. If I don't like the little sagging or the wrinkles that I'm developing, I can do something,
again.
a mini or
Right.
maybe a mild tuck
Okay.
or something along those lines to get the result that I want.
That you wanted.
Yeah.
Now, whatever it is that you have done, and I'm sure this is a question that you will answer on a case-by-case basis,
Yeah.
but recovery time. I mean, obviously, if you have something smaller done, it's not going to be as
Sure.
time.
Sure. So I think I do a really good job in terms of recovery for most of my patients. I would say 95 to 98% of all my patients, within 7 days, they're pretty much ready to be out and about in public. You know, if you have a bruise here and there, you could always put a little bit of cover-up makeup on, but 95 to 98% of all the swelling will be gone by 6 to 7 days.
Awesome.
So what I generally tell my patients is, you know, how long are you going to be laid up in bed?
Right.
1 day, right? The
Excellent.
same day of surgery. The next day, you could be walking around. I've had patients tell me that they've gone shopping the following day. I don't like that,
Right.
but you know, the sooner you're moving around and the sooner you get to more normal routines,
Yeah.
the quicker you're going to recover.
That's right. Wonderful. Well, we have so many more questions to get to, but we will have you with us next week and for weeks to come, so we'll talk more about all of the procedures that you
Great.
do. Okay?
Sure.
Thank you so much for being here today.
Thanks.
Thanks. Stay tuned, and Aging Gracefully will be right back. Joining us in the studio today is acupuncture physician Rachel Tuman, owner of Advanced Acupuncture at the Mind Spa. She is currently celebrating 28 years in the field of acupuncture and oriental medicine. And thank you for being with us on the show today.
I'm delighted to be here.
Oh, thanks. Now, a lot of people may not know what acupuncture actually is. So can you tell us a little bit about that and how it works on our body?
I'd be happy to do that. So acupuncture and oriental medicine is a system of medicine that's been around for about 5,000 years, so it's quite tried and true. And when we look at how acupuncture works, how do we interact with the body to make a difference to help support your health and well-being, I like to think of the comparison of an electrical panel in your home. You might need to turn the power off in your bedroom, but where you need to go to do that might be someplace else besides the bedroom. You might need to go to your garage or your laundry room or wherever that electrical panel is situated.
Right.
And so the power and the access to that power may be in different places than the actual area where you're working. So there are pathways of energy and acupuncture points on those pathways that allow me to access your systems in your body to support your health, to energize different areas, to calm down things that are overactive, to support or beef up the energy of things that are underactive.
So this is I know it's been around for over 5,000 years, but it's an interesting form of medicine. How did you choose acupuncture over other modalities?
Well, you know, I grew up in a medical family. My father and my grandfather were both doctors, and I sort of, you know, got a lot of modern medicine by osmosis. The thing that had me just need to study acupuncture was that I had an injury in college, and I injured my low back, and I used to walk like Quasimodo. You couldn't get me to stand up straight if I just said, "Buck it up, Rachel, just look, okay, don't look," you know. Walk down the street normally, I couldn't do it. And it was acupuncture that took away a lot of that pain, that allowed me to stand up straight, and that got me moving again. And as I would visit my acupuncturist, I would ask about other people that I knew. There was a gentleman who had an enlarged spleen, and he'd been to the Mayo Clinic, he'd been everywhere, and they just said, "There's nothing we can do, just live with it." And so I said to my acupuncturist, "Can you do anything about that?" "Oh yes, absolutely I can treat that." And then there was a woman who had agoraphobia. She was afraid to leave her home, and she had 4 acupuncture treatments in her home because she couldn't leave her home. She had 4 acupuncture treatments in her home, and after those 4 acupuncture treatments, she got a job. At this time I was in Chicago, and she got a job in downtown Chicago. So something from a very physical ailment like an enlarged spleen to something mental, emotional like a phobia, and the fact that these were the kinds of things that slipped through the medical cracks, that modern medicine didn't treat them or didn't treat them very well, or had side effects for those treatments, and that acupuncture could treat it and could treat it well. That's what had the bug bite, and I just thought, I have got to know more about this.
So you said your families were physicians. How did they feel about you going into acupuncture, and what kind of training did it take for you to become a specialist?
Well, I had actually quite a bit of support. My grandfather and my father were both non-traditional in the way that they practiced medicine. My grandfather was the first person to ever put color in a hospital room because he noticed that when it was all sterile white, people were afraid. And so it interfered with their healing. And my father was a pediatrician, and his focus was on what is causing this problem, not just let's give an antibiotic and then it's gone, but we don't know why a certain child is getting bronchitis every year at the same time of the year, that sort of thing. So that was the family emphasis, and so this apple didn't really fall very far from the tree.
Okay, so there's so many things to talk about because I have had acupuncture treatments. Can you tell us what kind of things can you treat? I mean, there's a variety, but give our viewers an idea of what they can go to see you for that you can help them with.
Well, there are probably about 60 different maladies that the World Health Organization has listed as recognizing that acupuncture is helpful for just every system in the body and every affliction, because when you think about it, this was the system of medicine in China for 5,000 years, so everything, it treated everything. Some things that I've had amazing experiences with, because I can treat everything from a common cold and a headache to a low back pain, but it's fun to think about some of the things that you wouldn't expect. I've had patients with cataracts who, when I stood at the foot of the table and said, "Look at me and describe what you see," "Oh, it's kind of cloudy, it's a little blurry," and then by the time I finished the treatment, I just stand at the foot of the table with no cueing whatsoever, but I just say, "Would you look at me again?" And they'll go, "Oh my God, it's clear. It's clear. How did you do that?" So it's kind of amazing to see that. Or I've had glaucoma patients whose whose pressure came down 10 or 15 points in a handful of treatments when they've had every kind of medicine
Amazing.
and procedure possible that didn't have an effect.
That didn't work. And we'll talk more with you because you'll be back with us, and we'll talk a little bit about maybe about the needles and maybe people's fear of that and how
Good idea.
we can get them to overcome that. Okay, so thank
I'd
you
love
for
to.
being with us today. And
Thank you,
and
Nancy.
We'll see you soon. Thank you. You can find out more information at www.advancedacupuncturesarasota.com. Thanks for tuning in on Aging Gracefully, and we'll return after the break. Our next guest, Dr. Jonathan Burns, is here today to discuss the benefits of epidural and pain management. So welcome to the show, Jonathan. Thank you for being here. Can you tell us why you decided to get into the practice of pain management?
Sure. I chose to specialize in pain management because I saw the profound impact that a small procedure or a simple procedure could make in a person's life. I mean, it could really turn things around for them. And sometimes people were kind of stuck in a rut and they didn't know what to do. And something as simple as like a small injection or an epidural or something like that could really change their life. And
So how do people know when they should come to you for an epidural? And what is it?
well, an epidural steroid injection
Yep.
is a minimally invasive procedure where an anesthetic and a steroid is placed in the patient's spine around or near the area that's causing their pain or
Okay.
their problem.
And this pain can be caused from a number of things, accidents, or what other
Correct.
types of
Yeah.
things do you see?
So a lot of motor vehicle accidents, falls, just wear and tear. You know, I have a lot of patients who they're doing fine and they twist and to pick up a pen or something and they get nailed with
Right.
pain in their back, shooting down their leg, like a sciatic type pain.
Right, right.
Epidurals in particular can help people who have disc problems like degenerative discs,
Okay.
spinal stenosis, a herniated disc. All those diagnoses can benefit from an epidural steroid injection very
Okay.
well.
And is it a one-time thing, or do you determine, depending on what their situation is, how many times they have to come back?
That's a great question. Sometimes people have a problem and it needs to be fixed right away.
Yep.
And so we do whatever we can to get that pain under control. Sometimes people need like a series of epidurals, and that's been shown to be effective in spinal stenosis, for example. So we'll do a series of like 3 injections, maybe
Okay.
1 or 2 weeks spaced apart.
Okay.
And that's good because the epidural will bring down the pain and it may start to come back. Then you can hit it 2 or 3 more times and it seems to last a long time after that.
And the reason that it lasts a long time after that is because why? It's relaxed the tissue around it, or what actually happens once you get an
Right. So
epidural?
the steroid and the anesthetic both decrease the inflammation around where the disc is damaged or where it's herniating out. It doesn't shrink the disc, but a lot of people have called it a Band-Aid, which is not a bad analogy because if you cut yourself, you put a Band-Aid on there,
Right,
and that
right.
protects the wound as your body heals. With the epidural, you're basically covering the pain as your body heals from the tear or disc problem that you have.
So again, the benefits are it reduces, obviously, the pain. And what other benefits would a patient see from having one of these treatments or a series of these treatments?
Right. The important thing from my perspective as a pain management physician is to improve the patient's function and their quality of life. And that's really the whole driving purpose of it, and that's why I chose to specialize in it to begin with,
Okay.
because little things make a big difference. You know, if you want to be able to walk at your daughter's wedding or pick up your
Yeah.
grandkids or
Yeah.
something like that, epidurals and things like that can do that and restore that function to your life that you may be missing.
So how many different types of epidurals are there? How many? I went on your website and I saw there was a couple listed. What can you tell us what the difference is between them?
Sure. There's 3 basic epidurals.
Okay.
One would be an interlaminar epidural, which
Yeah.
is between the bones.
Okay.
And that's good because it kind of covers a big area of the spine. So if someone has like 5 or 6 bulging discs in their neck, their back, or their
Yeah.
mid-back, that's a good procedure because it's going to cover that whole area.
Okay, so this is between your discs you're talking about, or your bones in your back?
Between the bones,
Okay.
between the lamina. They're called lamina between each level.
Okay.
Transforaminal epidural is an injection that's a bit more specific. So if someone has a disc herniation that's off to one side and it's hitting that nerve and
Right.
irritating your leg, for example, you can put a needle right near there and deposit the steroid and lidocaine right on that spot, and that seems to work really well.
Okay. And how long of a procedure is it when somebody goes in from beginning to end? I mean, 10 minutes, 20 minutes? I mean, how long does it take?
Usually about 5 to 10 minutes. It's a
Okay.
pretty quick procedure.
Okay.
Sometimes we do bilateral on both sides,
Uh-huh.
and that's really good for someone who has a disc bulge right in the middle,
Yeah.
and they have pain down both their legs, and you can kind of treat it from both sides.
Okay. And again, once they've seen you, you can determine whether they're going to need a series of treatments or not. And you said some people only need one.
Correct.
So is that because they've like you said, maybe bent down and just strained themselves, and they'll be good to go from there?
Exactly right.
Yeah,
Sometimes
okay.
people are in an acute episode.
Yep.
They need something. They're taking Tylenol or ibuprofen, and they're just hurting.
Right.
The epidural is perfect for that because it'll shut down the pain. They get back to their life and they heal up, and they don't need anything else. No surgery or anything like that.
Okay. Wonderful. Well, I really, you've enlightened me on a lot of things, and as somebody that has back pain, I will keep that in mind next time I need you. So thank you for being with us today, and we'll see you on upcoming shows.
Okay, it's been my
All right,
pleasure.
Great.
Thanks so much.
Thank you. Thanks for tuning in to the first episode of Aging Gracefully on Suncoast FYI. Join us next week for more discussions and advice to help you live a happy and healthier life, no matter what your age may be.